Good evening and welcome. My name is Chase Rend, and I have the honor of being the executive director here at the National Building Museum. And it's my pleasure to welcome all of you to the museum and to this evening's program. So as many as you probably know, the museum's mission is to advance the quality of the built environment by educating people about its impact on their lives. We do this through our critically acclaimed exhibitions, our award-winning family, youth, and outreach programs, and through public programs such as the one tonight. To stay informed about our programs, check out our calendar, go onto our website, become a member, and visit us whenever you can. Our program this evening is the first of a two-part series titled Livable Communities, which focuses on improving the built environment for aging populations. The series complements the museum's ongoing exhibition, House and Home, which you can find on the second floor here, by examining the connection between neighborhood design, public health, and quality of life of our aging populations. We are very grateful for the support of the AARP, which has enabled us to bring this series to you. Tonight's program, Healthy Neighborhoods, addresses design solutions, policy, and programming that can be applied to our communities to improve the health and well-being of aging populations. The series will then conclude on October 29th with a program titled Boomers in the Burbs, Aging in Place. The program will look at the unique challenges faced by the growing aging population in the suburbs and what types of design solutions can be implemented to help them age in place in an environment that is often not conducive to independent lifestyles. And we do hope that you will come back and join us for that program as well. And now it is my pleasure to welcome Nancy Lamond, Executive Vice President, State and National Group of the AARP. Nancy?
Well, thank you all for being here. I've run enough programs in this city to know that you are either folks that show up in rain and snow and sleet, or you were stuck downtown and thought if you came here you'd be able to get home faster. So regardless, we appreciate your being here, and AARP is pleased to be able to support programs like this. As was mentioned, I oversee the state and national group at AARP, and I'm really excited to be able to be here and for us to be able to sponsor programs like this. I myself am a fallen away city planner, having been trained to be a planner only to find out that there weren't any jobs in the area at the time. So this is kind of a busman's holiday for me. Today we're here to talk about designing healthy and livable communities for a multi-generational and rapidly aging population. Over the next 2 decades, many of you probably know these statistics better than I do, but every single state is going to see an increase in its 65-plus population by 51% in Texas, 56% in California, 63% in Delaware, and at the top of the charts, 113% in Wyoming. To put it in some perspective, by the year 2030, 10 states in our country are going to have more Medicare-eligible seniors than they have school-age children. This massive demographic shift has implications for every generation, and it will profoundly affect governments, businesses, nonprofits, individuals, and of course, communities. You've all heard about aging in place. Well, communities will also, by and large, age in place over the next few years. Research tells us that the large majority of Americans hope to stay where they are as they get older. And in fact, not only do people intend to stay in their communities, 83% of the boomers we survey say they expect to stay in their same house when they retire. Now the question is, will their cities and communities be able to meet their needs as they age? We know that boomers are looking for a community, and they're looking for what we all are. We want to live in places that are safe, affordable, and comfortable. We want to be part of a community that enables opportunity and entrepreneurship. We want to be connected all the time to our family and our friends, and we want to live in places that are walkable and accessible. But despite the aging, and despite the fact that communities know they need to change, Many have not yet made these adjustments to infrastructure and services to prepare for the future. Last year, we partnered with Governing Magazine to survey local leaders across the country, and only 16% of the communities said they were very or extremely prepared for the next 25 years. The good news is, though, and you're going to hear about some of these good examples tonight, is that we've seen communities make tremendous progress. There are pockets of innovation sprouting up across the country. Cities like Kingsport, Tennessee are passing complete streets policies to increase walkability and make streets safe for pedestrians. And as of 2013, more than 500 jurisdictions in 27 states, including DC and Puerto Rico, had adopted complete streets policies. Communities such as Richmond, Virginia, Maricopa County, Arizona, are using comprehensive planning efforts and creating regional plans to prepare for the housing needs of older adults at all income levels. The public sector is partnering with private sector in places like Las Vegas, where the CEO of Zappos has invested $300 million of his resources to make Vegas the most livable city in the world. Leaders at the state and local level are recognizing the intersection between livable communities and healthy communities, topic for tonight. Iowa Governor Terry Branstad wants to make Iowa the healthiest state in the country by 2016 and is working with Wellmark Blue Cross Blue Shield to create blue zones in 19 communities across his states. And there's so many more examples, more than I can probably go into now, but I want to do a pitch for you to go to a website we've created to give you good examples of things we're hearing about around the country and hope that you will let us know of things you're learning about as well. It's livable@aarp.org. Now, many of you know AARP is a national organization, and I can guess by looking at some of the people in this room, some of you may have actually gotten mail from us over the years. But in addition to being a national organization, we do a lot of work at the state level, and increasingly, we're doing more work at the community level. We have offices in every state, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands, and 36 of our state offices are actively working right now on housing and transportation issues. We want to bring those resources, as I mentioned a moment ago, to everyone, and that's one reason we've created this website, and certainly one of the reasons we want to be hosting programs like this across the country. Without taking any more time, I just want to thank you all again for being here. I hope that you will stay engaged with us and with the Building Museum as we do future programs. And with that, there's been a slight change in the order of the program. I have the distinct pleasure of introducing someone who is going to introduce herself due to the change in the program, the mayor of Asheville, North Carolina, Mayor Terry Bellamy. Thank you.
Good evening, everyone. Good evening, everyone. My name's Terry Bellamy. I'm the mayor of the city of Asheville, and it's a pleasure to be here. And if this sometimes sounds like a commercial, it is. And the reason that is, I've been mayor for 8 years and on council for 6, so 14 years talking about the city of Asheville. It's my hometown, and I'm biased. I love it, and it's the best city in Asheville, in the world. All right, so setting the agenda. One of the things I think is important to talk about, we believe in Asheville that your budget and your strategic plan are really your community's values. And so when we look at how do we make sure that our community is an inclusive community, we start with our budget and we continue with our strategic plan. And so we're going to talk about our strategic plan a little bit and our commitment to implementing it. We have some core values that we believe in as a city, and they center around economic systems. One of them is economic growth and financial sustainability, environmental systems, and social systems, and affordable housing and community development. And what does that get us? It gets us a high quality of life. And it's a continuum for our community. We look at from the cradle to the grave and making sure that when people come to Asheville, whether they're born or they choose to move to our community, it's a wonderful experience. It's a vibrant experience. And so as a council, we're always looking at how do we make Asheville a better place to live, a better place to work, a better place to play. And we partner with our county. Let's look at our city. And I do want to say this before I get into it. Asheville's population, our nighttime population is 84,000, but during the day we have one of the highest growth rates. It grows to almost 140,000. And we're the hub of Western North Carolina. And so that's significant for our community. And so some of the same numbers that you were talking about, Nancy, you see here of what we're expecting over the next few years for our community. And looking at the age population increasing in the community. And I won't read all this to you. So where do we look at the opportunities to ensure that we're inclusive? We're looking at our transportation planning, our recreation and cultural arts, and health and sustainability. Because we want to get people where they're engaging in our community. Where do we see people who are aging? How do they access services that we provide? It's not enough for us to set policy for others to provide. But what are we doing as a city? And these are the three areas that we have influence over. So for our transportation system, Nancy's already talked about complete streets. We adopted our complete streets last year, but we were already doing it without the name. And so when we heard about the name, we was like, well, we need to go ahead and do that because we're already doing it. And the reason we did, we want to make sure that Asheville was not just a great place to drive, and we respect the car, and we love cars. However, we found that a lot of people like to bike in our community, a lot of people like to walk in our community. And we wanted to make sure that as we look at the built environment, we make sure that our policies actually supported what we wanted to see. We looked at our transit system. Since 2005, we turned over our entire fleet, and now we all either have hybrid or diesel buses, alternative fuel buses, in order to make sure that it's environmentally friendly, but we wanted to make sure that it was also user-friendly, and so we made sure that our buses now, they lower to make sure that individuals who are in a wheelchair can access the buses. Those who are biking, we put bike racks in the front of our buses to ensure that those who are biking to stops, they can also access our transit system. We changed our rate structure. We didn't have a deep enough discount for our seniors. You couldn't see a difference, and we had a lot of seniors who were accessing our transit system, and so we changed our transit rates as well. It's not enough for us to make sure that people can have access to services. We are putting our money where our mouth is. The city of Asheville is an entitlement city, so of course we get community and development block grants, funds from the federal government, and home funds from the federal government. And yes, we target some of those funds for affordable housing, and yes, we fund some of those funds for senior housing. But we also have a local affordable housing trust fund. And what that is, we take approximately 1% of our tax rate and put it towards affordable housing. It's a little less this year because of budget cuts, but it's right around $600,000 in that pool. But what we're doing is making sure that we're spreading that money around to not just affordable housing for working families, but also for our senior population. Because we want to not just talk about those things, we want to make sure that individuals who have made our community great or who choose to come to our community can afford to live there as well. And this is an affordable housing development that was created by Mountain Housing Opportunity, and it's a mixed income development. We looked at our activities for our seniors. As we were looking at how do we ensure that our seniors have a place where they can go and recreate and have the opportunity for physical fitness, health and wellness, get nutritional information, a place where they can get information about how to use the computer. It's funny to see them try to tweet it, and that's another story. No, you have to use more than that word, but it's not 140 words. It's just funny. Anywho. And so we have two senior opportunities. We have two places for our seniors to enjoy themselves, and that's the Senior Opportunity Center and Harvest House. And they plan trips for each other. They have meals together. It's just an opportunity for our seniors to come together and enjoy each other. And that's not my timer. No, okay. One of our partners in the community is our university. We have an interlocal agreement between the university and the city of Asheville, one of the first in the country. And one of the things that we are striving to do is to ensure that our university is not an ivory tower sitting out in the northern part of the city that doesn't interact with our community. We are completely integrated. We have a commitment to work together, and one of the ways we work together is through the Rorter Center. The Rorter Center is a center that's only for our senior population, and it's an opportunity for our seniors to reinvent themselves. We have physicists who've come to Asheville. We have attorneys who've come and retired in our community who go to the Reuther Center and they take classes on how to horticultural. They get information on different types of careers that if they want to reinvent themselves, they're putting them on the path to do so. It's an opportunity to learn about programs in our community. And it's also a way to give back. Each year, they decide on one big project that as seniors, they want to do collectively in our community. And it's a joint venture. And it provides them an opportunity to learn more about our community. And what we're finding is people who've moved to our community, who are seniors, who've retired, take the opportunity to learn more about Asheville. They get integrated into the community a little bit stronger. We've also made a huge investment in our greenways. We developed a greenway master plan, and we want Asheville to have a necklace around its neck of greenways. We want Asheville to be a community that is bikeable, walkable, and accessible. And so when we think about multimodal, we're not just thinking about how can a car get through our community effectively, and how can a bus get through our community effectively. We think about how can canoeing work in Asheville. How many cities think about that? We are very out of the box because we had some people who were getting their canoe and commute to work. I had to see it for myself, but it happens. But anyway, we're thinking about how does that work, and that works through the connection of our greenways. As a community, we've made sure that health is important. And so we have a food policy council, and it's a council that's made up of different providers in our community, from the health department to food service providers to farmers to people who are interested in food. And we had to look at ourselves to say, what are we doing as a city to make sure that our kids, our seniors, have access to freshly grown, locally produced food? And we were a barrier. We found that out. So one of the things we did, after the food policy was put in place, we adopted an agenda for the city council. It's a multi-tiered plan. We changed our ordinances. Now every church, every school in our city can now have a tailgate market or a farmer's market, either way you want to say it. And there's less regulation. We reduced the permitting costs so that there would be no hindrance for farmers to be able to bring their wares to our community. And what we're finding is there are people who have their own gardens, who have enough to be able to sell. We changed our ordinance. You can now have chickens in the city. No roosters. But you can have 6 chickens. And so we're making it so accessible so that people can grow their food in their community, they can sell their food in the community. We have young kids who are now taking the extra eggs from their hens down to the tailgate market and selling it to the neighbors. And so it's something that we're making it accessible in the city, in the urban environment, in the mountains of Western North Carolina. We recognize we're not perfect, and so we're still working on some issues. And so we have an opportunity with MacArthur Foundation. They gave us an opportunity to look at our seniors and to say, what can we do to make it even better for our community? And so we're looking at something that will have a positive impact. And so we put together a team of people who work with the Council on Aging, the university, our staff, the county staff, to look at key issues, and we've started to look at transportation, we're looking at housing, and we're looking at accessibility of programs for our seniors. That's not mine, so that's telling me I'm through. I was about to say, where did that come from? I just want to say thank you so very much for having me. It's been a pleasure to be here. I do want to say thank you so very much to AARP and so much for allowing Asheville to be highlighted as a community that's on the forefront of these issues, because we really care about how people live in our community. To Kaiser Permanente, we thank you so very much. The tour was awesome. Really enjoyed that. If you have not had it, it's a wonderful building facility they have that's available for people to take a tour. The last thing is I'll say, come to Asheville and spend money. We were the last city to go into the recession, one of the first to come out, because I keep telling people to come to Asheville and spend money. Thank you all so very much.
Okay, so because of the weather, Mayor Bellamy has to go back and serve her people. So we engineered a fun little rearrangement of things. So I'm going to go. We're going to see your slide deck in reverse. See on one slide. So enjoy it one more time. Great job. Okay. So hi, I'm Ted Eaton. I'm from Kaiser Permanente, and this is where I work at the Center for Total Health. And I titled this slide "We're Here from the Future" because I was with the panelists earlier. Who has been to the Center for Total Health? Some of you have. At least 3 people, 4 people. Okay, good. That means there's like 60 more yet to come. So we're happy to give tours. That's a large 80-foot video touch wall in there. It's a place devoted to conversations about health. I gave our panelists a tour, and it was just really awesome to have, a mayor, an epidemiologist, scientist, a planner, Amy from AARP, they're with us and talking about the fact that things are changing and the health system involved as well are changing the way that we live and think. So I'm excited to be here, and please tweet us there. And by the way, Mayor Bellamy is Terry_Bellamy if you'd like to tweet her on her way out. So I'd like to just say who our panelists are. And you saw me give Mayor Bellamy a hug, and that's actually part of the way we do things at the Center for Total Health. So when we do give people a timer so they know where they're at, and then when it's time for the next person, we like to show gratitude instead of saying your time is up. So I offer everyone a hug or a handshake to show gratitude. So you'll see me do that depending on the person. So let's start with, let me just basically briefly say who Scott and Irene are, and then they're going to come and give a little spiel, and then we're going to talk up here. So Scott Ball is with Commons Planning. He's based in Atlanta, Georgia, and has managed several redevelopment efforts along the Gulf Coast. Prior to that, he served as Louisiana Road Home Programs Director of Rebuilding and Construction Assistance, which he helped start up Louisiana Storm Recovery Programs. He also created the Aging in Place Toolkit, which I saw online, which is an awesome resource, even though it's been around and well quoted for a while. He's co-authored the Land Use and Public Health Toolkit for the National Association of Local Boards on Health. Irene Yen is here. She is an epidemiologist and associate professor of medicine at the University of California, San Francisco. Just came in today for this. That's how important this is for her. Her research focuses on the social determinants of health, specifically neighborhood and place. She was the 2010 to 2012 Atlantic Philanthropies Health and Aging Policy Fellow, working with the Centers for Disease Control and Prevention's Health Aging Research Network. Her policy fellowship investigated how Complete Streets design strategies that can support older adults' mobility. And she also curates the Complete Streets page on Facebook, I learned tonight, so you'll see that as well. So let's see, so it's Scott first. Yes, come on up.
Okay. And this is, my name is Scott Ball, as you said. This is my new book. It's the other publications he mentioned are free. So this is the one that you really need. It's ridiculously expensive. And what I'm going to talk about today is the livable communities in relationship to the way we think of data and information, and the way data and information are building our cities, are shaping our cities. So these terms are all related. The healthy, the sustainable, livable. These are ways we're beginning to talk about communities. And I think there's a tremendous amount of promise in these terms for us to reposition as professionals. I think on the downside, these terms run the risk of being sort of branding, faddish kind of branding names. On the upside, I think there really is a potential to change the way we go about doing things. I want to talk about that a little bit in relation to this data and information. This is from yesterday at rush hour. This is the city here, DC, and this is Google's traffic monitor. And you probably have all used this at one time or the other. This is done, the information you're getting here is from smartphones. People are in traffic, talking on their smartphones, and Google is picking up on that and monitoring speeds. They're also monitoring construction projects, as you can see. And so they know the relationship between those construction projects and speed. What is phenomenal about this is not only that they have figured out that a smartphone is secondarily a phone, it's primarily a tracking device and a data generating device for groups like Google, but what they have figured out is that this information has enormous value. So this is not only being tracked, but Google stores this information. They're recording the movement of the United States and storing it. So what we have is this enormous volume of information about how people are moving through. This is only cars, but there's also people walking, that's tracked. You know, the idea that you have to wear a pedometer, I mean, that's going to be gone in another few years to do any kind of research project. So this is an enormous volume of information. It's not only being stored, but we're thinking a lot about how that's gathered in certain circumstances. In transportation world, if I want to learn about highway speeds or road speeds in Georgia, as in most states, the only recognized way to do that is to go put some rubber tubes out in the street with a monitoring machine, very expensive and very inaccurate. Much better data here, it's just not in our planning world. It's outside of our reference points. So this is the homepage of Yahoo on February 1st, 1996. This is what it looked like. And what is stunning about this was the Sisyphean task they had set for themselves of trying to organize the internet, right? If you all were using the web back in 1996, you'll remember that to get to anything, you had to think like a card catalog system. You had to think, well, is this a government issue? Well, I'll go in here. Is it a health issue? And somewhere at Yahoo, there was some staff frantically trying to file everything that was coming up into this static index system. And at the time, if you entered a search term in here, like National Building Museum, I don't know what happened there. If you entered a term like National Building Museum, you would suddenly get, in no hierarchical organization, every single mention of national, every single mention of building, and every single mention of museum. And it was useless. So your only way of really getting to things was through this index system. 1996. 1996, in internet terms, was just after we had harnessed the power of fire, but just before we had invented the wheel. I mean, that's sort of where it is in internet years. Now what we do, and does anyone have any idea why the PC is doing this? God, I love Mac. Oh, now it's gone, okay. So this is actually a mapped analog search. This is a guy in, I think, Sweden that's beginning to do graphic maps of how algorithm searches are done, like in Google's Finder. And what you see is now a movement away, a total shift away from indexed, fixed systems of thinking to very fluid relational systems. This is a map of various data points, the movements between web pages, and out of all this mesh, you begin to find little hubs, and that is essentially what produces your search in Google. And the sites you're given to go look at is this very complicated relational database look. On the other side, we are having increasing amount of information that comes on credit cards. Every time you buy something, that's stored, and then that information is sold to analysis companies. So we know a tremendous amount about how you're moving through the environment, what you're buying, what other things you're buying, and how this thing you bought relates to that thing you bought. So what we're learning from this credit card data is an enormous amount about the behavior of people in the environment. We're learning about traffic speeds, we're learning about how your social relationships work, your schools work, your community, all of that can be gathered with data that we have currently readily available. And the group that does this, as a planner, I can tell you, everything we do, nothing gets built without a heavy-duty market study. Right? Nothing of any value gets built without a feasibility analysis. The core of that is this Nielsen database. 90% of all market studies use this. It's called PRISM. And there was a time, not 10 years ago, when there were 4 basic market segments. There were young adults, that were maybe moving into an apartment. There were young families. There were older families. And then there were empty nesters. Those were your market segments. Now we have 66 market segments. These are a few of them I pulled out. That's the whole display. These are a few of them. The thing to notice about this is these are beyond data points. These are such blended metrics of both geographic and demographic information that in order to refer to them, you use these very flowery kind of titles. I mean, this is what builds buildings now. Are you keying the simple pleasures demographic, or are you keying the bright lights little city demographic? That's what we work with. I mean, this is really how investment dollars flow. This is the main database. So when you're talking about livable communities or healthy communities, it's part of this movement, not to soft science, but to very complicated, blended metrics. This is part of a study we had done in Atlanta about aging in different places in the region. And our market analysis, Zimmerman and Volk did, a very good group. And what they ended up with was a system of allocation. What we do now is you don't build for a single demographic. You think about allocations for demographic. You don't have to think about old people want to live here. You think about this subset tends towards that, and you end up trying to allocate resources towards that across a broad spectrum. These are the various types of folks and the various types that we predicted areas that they would live in the Atlanta area. Again, sort of flowery titles. And that puts healthy communities, or idea of planning, or a goal of planning, right in the middle of a very complex sort of ripple of information and web of information. Now, what I want to talk about is the state of planning, real quickly. This is basically the major index challenges we have in my world, city planning. The way we think about streets, land uses, and houses. This is the old Yahoo system. This is turning our backs on the data that actually funds investment, that directs investment. It's turning our backs on that, and it's instead using these very static and useless and irrelevant indexing systems. And these are not only antiquated, they are very damaging. I think it's not just between fire and the wheel. I think this is prior to fire. We haven't yet harnessed fire in this form of thinking. The first is the simple use method, the idea that you think about planning the environment around singular indexed uses. We have an area where there's single-family housing and multifamily housing and commercial activity and recreational activity. I mean, what kind of nonsense is that? I mean, you would separate these activities, all of which you would think would be part of any normal day, across maybe a 6-mile area or more. The idea of thinking with single uses is damaging. What we're now thinking more in terms of, either in transects or however you want to refer to it, is a more complex way, a more livable framework for understanding land use regulation. And that is that you start thinking about suburban, town center, and city center, or urban center. These are about ways people behave in spaces. These aren't about specific uses. These are about specific kinds of behavior and activity, more in line with the complex information we know from the Nielsen system. Right? These are blended matrices. And again, in housing is a critical issue, that we no longer think of attached, single-family homes, apartments, multifamily townhomes. What you're thinking of is the home attached, detached, stacked, or mixed. This is much more with how we live. The fact that I own a single-family home does not mean that I don't have a friend living with me, doesn't mean that I don't have a caregiver living with me. It's not a single-family home. The important distinction is not the family unit that's living in it. It's the way people are behaving. In roads, and I think this is a big challenge in complete streets or in everything, to start thinking about what we want to index in the way we plan roads. We want to separate and think about through streets as different from local streets. And this is tearing our environment apart. The idea that a through street where regional traffic is moving has to be something entirely different and thought of differently than a local street, which is more like this, a cul-de-sac, right? That is how transportation planning wants to work right now. Massive collectors and arterials with local cul-de-sacs. That division of local street and through street has an effect not only of tearing apart the environment and separating uses and the daily functions of life, but it also is a problematic sort of social function. You only know here really your people on your cul-de-sac. In a gridded transportation pattern like that, you have much more ability to move through this environment and know more people. You have a sense of autonomy in your relationships. So I'm finishing. So the thing that the hug is coming. I have to finish. I tell them, I have a Calvinist family. The public display of affection would be the worst possible punishment. Yeah. So the system that I hope we can move beyond is thinking about healthy communities and these livable communities. Not think about that as an index. You're not trying to rate cities for livability or lifelong ability or healthiness. That is a static measuring system. What the promise of these terms is that it provides an opportunity for us to work in a blended metric way, getting away from these index systems to more complex relational ways of tracking and planning our environment. And with the end goal that you end up understanding better these relationships between individuals and their physical environment. By the way, the chart that I was using comes from the ecologic model, which is Irene's public health field.
And I think that the logic of my presentation is to talk just briefly about what we mean in health about social determinants, because that was the topic I was assigned. And then also to then, I think, frame the rest of my talk or bookend it with a discussion about complete streets, the motivation for the policies that are spreading around the country locally and at the state level. And then if I have time, and I might have overpacked myself, I wanted to just talk a little bit more specifically about what the policies are and the fact that we have an opportunity at the national level. And we're really looking forward to hearing what your questions and comments are. So we're trying to keep our presentations provocative in order to stimulate your conversation. So that was my outline. So I wanted to start off with this is a figure that got published in 2002 in a pretty highly esteemed health journal called Health Affairs. A couple of colleagues of mine at UC San Francisco have submitted an article under review that slightly updates the percentages on the model, but I've been told insider information that for the most part the percentages haven't changed. So these are considered the key determinants of health. When you talk to health and medical professionals, this is how we break it down. And what I wanted to alert you to was that social is thought of as being responsible for about 15% of our health. And when I say our, I mean individuals collectively, so any one of us individually or as a population. And when we say social, we're talking about income, education, social class, social factors. And I could talk a lot about that, but that's not my job here today. Behavior is 40%. And behavior, from a health perspective, is diet, physical activity, smoking. And then 5% is environment, and that can be defined as a pollution, environmental toxins, and increasingly now neighborhood and place. And neighborhood and place actually also affects behavior, which comes up in Terry Bellamy's talk when she talked about food and housing and aging in place, and certainly Scott in terms of planning and how we're designing our environments, connectivity, road throughs, and things like that. So I left up those two arrows because I think it's really important to look at the fact that almost 50% of what causes or influences or maintains our health and wellness are behavior and environment. So not genetics, not health care. So here today, of course, we're talking about built environment, and I think those play very important roles in the behavior and environmental slices of this pie. So complete the streets policies. Nancy also mentioned that 500 local entities have adopted them at this point in time. And I just want to say it's in great part from a policy perspective motivated by safety and injury. And you can, on any given day, look at your local newspaper's website and very likely find a headline like this. This is from my local San Francisco Chronicle website. And I got the invitation to come here in July, so I started putting together my talk then. And this is from a July San Francisco hit-and-run injury. And then I also looked locally in the DC area, and this is from College Park. Pedestrian crash sends one to the hospital. This is something that's happening on a regular basis. It's actually a pretty serious problem. In 2010, over 4,000 pedestrians were killed in traffic crashes in the United States. 70,000 pedestrians were injured. What do we know about pedestrian injury? 2 out of 3 pedestrian deaths occur on roads that are eligible to receive federal funding for construction or improvement. So we're thinking about this from a policy perspective, right? Over half of pedestrian deaths in the 9 years or 10 years from 2000 to 2009 occurred on roads with speed limits over 40 miles per hour. Of the over 47,000 pedestrian fatalities for which the location of the collision is known, more than 40% occurred where no crosswalk was available. So we've got federal funding for the road, higher speeds, no crosswalks. These are all, well, not aside from the funding, speed and crosswalk are design and safety related items. And then finally, older Americans are nearly twice as likely to be killed while walking than those under 65 years of age. So this is a very important issue for older Americans, the ability to safely walk places and not get, to do that safely. So I'm the health person. Of course, we do walking for a whole variety of reasons. It's the most common exercise for older adults. It's very important for health in terms of muscle maintenance. If you are able to walk, you can maintain your muscle. That helps you not fall. Falling is a really serious problem for older people. It's a really great way to maintain your weight. Obesity is a huge health situation in our country, as you've probably heard. It's important for heart health, diabetes, stress maintenance, stress relief. It's very important for cognitive functioning. It's really important for older people, for all of us, to be able to walk. Scott already mentioned connectivity. I hope connectivity is the appropriate word to use from a planning perspective, but if you have a more connected neighborhood residential environment or any kind of environment, you have access to more things. I mean, just for a walking route, then you can take perhaps a circular route or a more interesting route, and you can also get places potentially, get to services, get to stores, get to bus stops. So that's a design piece that can support walking. Certainly, sidewalks are really important. A lot of places don't have sidewalks, and therefore, if you're walking, you're putting yourself at risk to expose yourself to traffic. That's not a big surprise, right? And then, as I mentioned earlier, crosswalks are an ongoing thing. So there's places you want to cross, but you can't cross safely, but you cross anyway because you want to cross. And then aesthetics turns out to be a really important part of this. And I gave a really extreme example here of just having junk around. But if your walking route's not pleasant, if there's nothing for you to do there, you don't have a place to sit, there's nothing to do there, nobody to meet, you're probably less likely to do it. So these are all ways that design can support our walking. AARP put out a really great report, Planning for Complete Streets, in 2009, and what they reported, 40% of adults aged 50 and older reported inadequate sidewalks in their neighborhoods. More sobering, nearly 50% reported they cannot cross main roads close to their home safely. Half of those reported that such problems, half of those who reported such problems said they would walk, bicycle, or take the bus more if these problems were fixed. It kind of all fits together. Okay, so I wanted to mention social connections because designing places in a way that makes it possible to get out and walk around means that you're probably more likely to encounter other people because people are reacting the same way you are. And in that way, a place can build an identity and you can run into people and form community with them. And this actually can be very important. This is a picture from Chicago, the Little Village neighborhood. Has anyone read the book Heat Wave by Eric Kleinenberg? It came out in the early 2000s, I think. I highly recommend it. He's a sociologist at NYU. His current topic of research is actually older people living alone, I think. But this was his doctoral dissertation research about a 1995 heat wave in Chicago, a very serious 10 days of heat over 100 degrees. Over 50,000 people lost power. Hospitals had to close because so many people were coming. There were ambulances lined up literally around the block. And over 730 people died. It was a very serious event in our country's history. And it's not something that probably a lot of people have heard about. It turns out heat waves are a very serious problem for older people. And actually, in looking up some information about this to prepare for today, I actually found out, I didn't know, that in July of this year, there was a really serious heat wave in London, and over 700 people died. So this fits in with the current situation with climate change. If you hadn't made the connection yet, is that as the temperatures are changing, we're going to have, we think there's going to be more, spikes and waves of elevated temperatures, and in fact, this is going to put some of our more vulnerable populations at high risk. Little Village is a poor neighborhood in Chicago, and they had a lower mortality for their older people during the 1995 Chicago heat wave than North Lawndale, which is an adjacent, also poor community. North Lawndale had a very high mortality rate of their older residents. And what Eric Kleinenberg found out is that a lot of it had to do with the social fabric of the two neighborhoods. Little Village is now a Latino neighborhood. It's very vibrant. The streets are bustling. People are out all the time. The older people come out and they come walk on the sidewalk. They stop in the shops. The shop owners know them. When the power stopped for these people, it was very, very hot inside. They would come and sit in the shops where they had fans blowing, and they could visit with people. In North Lawndale, it's a bombed out area. There had been a factory there. It had relocated. The working age people had all moved away. The support services that had been there to provide lunches for the factory workers had all closed. Very little going on. The older people stayed indoors, and then they died, and nobody knew. So it was very stark contrast between these two places. And so how the places were designed and what was going on, the activities, the business activities, the community activities, made a difference in what happened to these people during this time of high stress and the high heat. And I just included a picture from Portsmouth Square in San Francisco, which, if any of you know, San Francisco is a popular gathering place for lots of people. In particular, the older Chinese people gather there and they do Tai Chi, and they sit during the day and they play Mahjong, and they might watch their grandkids and things like that. So just to highlight this point about place identity, place formation. And I was trying to find something for the GCR. I believe this is Franklin Square, and I think this is lunchtime. So as I said, I was trying to bookend with policy. I have a minute. Right now, current federal statute actually requires state departments of transportation to use a portion of their funds to hire a state bicycle and pedestrian coordinator. Did you know that? I think that's so cool. Complete Streets is now a federal bill under consideration, actually called Safe Streets. It's been up twice before and didn't make it through. This is the third go around. Already 28 states have Complete Streets policies, about 500 local governments. This is an example of what Complete Streets can do. This is an intersection in Florida. Just take a look right now what you've got here. No sidewalks. Now you have a labeled crosswalk, you've got sidewalks, you have green, you have trees, and a roundabout, which is a traffic management tool, and a bicyclist. I believe this is actually not that expensive to do. Maybe somebody can correct me. But this is going on now all around the country. Now that the policies are in place, we're in the implementation stage, and there's challenges associated with that. I wanted to just end by also saying that Complete Streets and these design things that some of us have mentioned aren't just for older people, of course. They're actually for all of us. They're for people with young children, if you're pushing a carriage. There are people who have mobility limitations, might have to walk a little bit slower for whatever reason. So we're all living together. We're in this together. These policies will support our lifestyles as communities. And I think that we don't have to segment ourselves in that way. And we can advocate for each other. And then I'm selling something today, too. It's my Facebook page on Complete Streets. I've been maintaining it for the last couple of years, ever since I finished my policy fellowship. It's where I put links to resources around livable communities, aging in place, public health and design connections. And I do interviews from time to time of planners and public health planning linkage leader, think leader people. And I invite you to come take a look and like my page. Thank you very much.
I love that Mayor Bellamy went first, because we want to highlight places like Asheville that are thinking about this, that are trying to make some changes so that we can better support an aging population. And as Nancy mentioned in the outset, 36 of our state offices are doing work in communities on the ground to make sure that not only can people get to doctor's appointments and walk around their communities, but meet a friend for a cup of coffee, really engage with each other. So we're thrilled that we're talking about these issues and shedding more light on them.
Awesome, very good. So as we were touring the Center for Total Health and talking, and you've seen today, one of the things that we touched on was the power of communication and words. So there's a lot of work to be done and many different ways to innovate. Raise your hand if you know where the term Complete Streets came from, if you just know. Oh, only a few people, great. So this is actually a cool story. So Scott, tell us about the origin of that term and what it has done.
Oh, now I'm in trouble. Jana's going to have a different idea about this. But
well, you'll come up later. Yeah.
My story was that David Goldberg got on a kick about changing in the federal transportation funding cycles, there was a thing called routine accommodation. And that sort of covered everything from sidewalks to bicycle lanes, and none of it was ever done. And David got on this kick that until you change that name, I mean, who wants routine accommodation? You want a complete street. And he led a campaign for, Jana's going to have a totally different idea about this. Jana's the director.
Well, we'll have to hear from you when it's time. That's good. So get ready, get ready. And so has that? So you use it's the title of your Facebook page. So obviously that term has resonance. Is it moving people to action?
Well, I liked it because it's the short version, as I understand it now, for design principles for streets to be accessible to people of all ages and abilities. Mm-hmm. So that it's a shortened form with the tagline that comes after it, and because that's the labeling that's being disseminated through the local and state and now federal policy world, the planning side. Public health people, for the most part, won't have ever heard about it.
Not yet, or they have already. They're starting to.
Well, even so, American Public Health Association has a transportation and health subcommittee, and they, folks who are on that committee might know about it. But just even the combination of transportation and health is kind of a niche area, I would say, in health. And that's one of the reasons why I wanted to start the page, was that I was interested in spreading the word just in general. Actually, I can tell you why. The Atlantic Philanthropies program officer that supports the Health and Aging Policy Fellowship, which is not, I have the CDC posting, but people stay in Washington and do staff positions for senators and congresspeople or in the Department of Health and Human Services, so we get spread out. But the program officer said to me, does the general public know about this, and are they advocating for it? Are they pressing their public officials for it? And I wasn't sure, and I was under the impression it was probably not generally known. I thought it would be more something that would be known within special communities of people. Mm-hmm. And so I thought, well, maybe I'll start this on Facebook, which is, of course, available to lots and lots of people, and see if they come. I'll build it and see if they come.
I forgot to ask, who here has actually heard of Complete Streets, just in the audience?
See, this is
have.
the danger of DC. Janet
Right.
Lina is AARP's Director of Transportation Policy. So, yeah.
Has our neurologist heard about it? You have? So I think it's emerging in healthcare, and I would ask the panelists, all of you, do you think that that's a useful thing for us to adopt that haven't yet? Is that something that would unify us, that concept? Or are there other emerging concepts? Let's just talk about communication for just a second longer.
Well, yeah, I mean, I think it absolutely could be a unifying concept. I mean, one of the ways that AARP is trying to contribute to this, Irene, you just mentioned getting everyday people and activists involved. A lot of our states are having a lot of success by doing that, by getting volunteers, AARP volunteers in red T-shirts with the AARP logo to go out and survey the streets, because most of us are in our cars, and in the DC area, not quite as much. We're a little luckier, but a lot of people are in their cars, and their eyes are just open when they go out and actually walk a street and try to cross a street that they've never crossed before. And I think that in New York, for example, we had 1 week, we had 500 volunteers 2,000 volunteers look at 500 intersections across the state, and then submit what they found about those intersections to their local leadership, and changes were made. Sidewalks were put in, light times for crossing the streets were increased, so traffic safety measures were developed. So I think doing that kind of work, getting people involved in their own communities, has been really tremendous for us.
I mean, you posed the question, so I'll offer a critical perspective, just for the hell of it. I mean, it's a great program, and it's a bit like punching baby seals to offer a critical perspective, but I'll do it.
Go Scott.
I presented this problem of the local and through street, what they call dendritic planning in transportation planning, that where you have a hierarchy of streets. Well, I don't believe we're going to get to walkable communities of any kind until you move away from that paradigm of transportation planning. That this is so toxic and so damaging in the built environment that it eclipses every other concern that I would have as a planner. What Complete Streets does is provides a fix for the streets that we have now, and that's an important thing. But it is a system that doesn't say you put a sidewalk and a bicycle lane on every street. It says there are different kinds of streets that have different kinds of pedestrian emphasis, right? And it's very important that you not reinforce the dendritic planning system in doing that hierarchy. In the end of the day, when you lay a transportation system out across America, 80% of America, that is focused on collectors, arterials, and cul-de-sacs and local streets, that is so hard to fix. I mean, that's a 100-year investment. And then the repair to that is unimaginable. You know, to fix that environment is very hard. So I would be careful about polishing brass on the Titanic. I would not personally pursue a complete streets policy without also a policy to attack head-on the paradigm of dendritic transportation planning.
So would you say maybe complete streets is a lead-in to a greater solution? So I like the idea that if people want to get involved in their community and make improvements, this is a way for them to learn about, planning, which they don't do, and it's an entree into that.
Great. And actually in Atlanta, where I'm from,
yes.
I mean, the benefits of the Complete Streets program, I mean, I can bike from my house all the way across the city now without any traffic conflict.
Celebrate.
It's a huge improvement.
By the way, who here doesn't own a car? Raise your hand, just out of curiosity. All right, DC, 40% in the city. Okay, so let's talk about, so we've said all ages. Let's talk about all ages for a second. So is there a difference between creating a livable community for someone that's older and younger? Let's talk about that. Or what needs to be done differently? What is not different?
Well, I think what I'm after and stuff in terms of blended metrics and showing like a 66 market segment distribution of the population is these categories are very complicated. And the way a city works, it can work differently for you at 4 years old or at 70 years old than it does at 30. You know, it's hard to say there is a form of an urban form that benefits all ages. But I think if you take care of younger children and you take care of older adults, that most of the middle you're going to catch. That you're gonna create a livable environment for everyone else. So I think you can prioritize those things in planning. Older adults have suffered in the planning world decade after decade by every time a planner has been asked, how do you plan for older adults? They've created Sun City or the gated retirement community, and they create a specialized form for older adults. So in a way, you want to think about it not as a specialty issue,
Great.
but as a...
Great. Amy?
Yes, well, we say all ages very purposefully, because for a couple reasons. One is what Scott just mentioned, that if you plan for the young and the older, then you essentially end up covering everybody. But the reality of our lives is that people live with their families. They care about their families. It's not realistic to have the Sun City and this, another community right next to each other. That's not the reality of a community. It's not what most people want out of their communities. And, our AARP members have told us they care about their families. They want their grandchildren to be safe. They walk to school. They want their kids to be able to walk to school. So we want to make sure that this is, holding hands and working on something together versus pitting generations against each other. Because I think at the end of the day, the outcome we are trying to reach is very similar. And a lot of the fixes would work for a lot of people.
That's cool. And Irene, given that you are in an academic medical center in healthcare and medicine, we've spent a lot of energy to highlight some of the issues that older people have. And so this is a very holistic way of planning a community that is maybe something new for medicine, or what do you think?
Yeah, I was actually, I am an epidemiologist, and my background is public health, but my professional life is in an academic medical setting, and I have another hat that isn't in my intro for you, which is I'm also now the research director in the Department of Medicine at Highland Hospital, which is Alameda County, Oakland's safety net hospital. So I'm really even more connected to hearing about patient care and with patients who are in very dire circumstances. I can take on that clinical lens much more readily now, and I started thinking about medications, so so it would be kind of food, fresh air, exercise, being able to walk around, and then I thought medicines because I think that I've heard a pharmacist say that the average age that you start your first medication is 40-something in this country. I mean, the medical professionals can help me. I was really surprised. Does that ring true to you? You know, diabetes, hypertension, high cholesterol, those all can ask for medical therapies that once you start, you take them for long periods of time. So, for me, what I was thinking, I wouldn't design for different ages, but I would look at the poverty, non-poverty, or resource I think that maybe what the danger of the dendritic planning paradigm is, and using the complete streets model, is it's too easy to let the political process do its thing, and then the resources concentrate. They're always concentrating, so, and the people who have things get more things. So you get the even better design because we know more about how to do the design, and the people who didn't have them to start with still aren't getting them, and so then we just perpetuate other kinds of problems.
I love how dendritic also is like that's kind of a medical term also, right?
Is it?
Yeah,
yes.
the way nerves are proposed. So there's some crossover. We need to help each other.
In the brain.
Oh, wow.
Yeah.
There's
So
tree.
let's talk about before we're going to do Q&A in exactly 3 minutes. Let's talk about disparities for a second. So what about vulnerable populations? So Irene, you kind of talked about a vulnerable population that did better because of their social, I assume.
Yes.
But what are the things that you've learned? Because you've done a lot of research that you didn't get to share. I want to just bring that in a little bit.
The ones that do better?
Just vulnerable populations, disparities, what you've learned.
Oh, so here, it's interesting. So I was fascinated by how much data Scott was presenting, because I was thinking I'm supposed to be the data person too, but I didn't actually have that much data in my presentation tonight. In fact, I would say that the research in vulnerable populations is underdeveloped, and we have a lot more work to do, because we're using metrics that have been developed in general populations and applying them in the vulnerable populations. So in the end, we don't distinguish very well among the vulnerable populations, and vulnerable populations do have assets and resources and can do things, and yet if we use the wrong metrics, they end up getting all lumped together, and they don't look so good ultimately. So I think, though, that social scientists and people who do more qualitative narrative research are able to get some of that out of there, if you will, and what we need to do is provide them the opportunities to do more and ask their questions, because they will actually be able to find out things that we haven't been able to find out so far with the large-scale surveys with the really simple questions. Mm-hmm. And I really hope that there's more support for that, because I think we will learn a lot that will be extremely helpful.
Mm-hmm. And Scott, so that Nielsen model is fascinating. There are things, I love discovering things that we don't have in healthcare that you have. So we thought Irene would be the data person, and you turned out to be the data person. Is there disparities? Is that encoded in that data, like differences in populations, or is it just very generic?
What Nielsen does is they take all the data and then they find the natural groupings, right? There's a way to do that. Like you do quintiles and GIS a lot. They've determined 66 is the number they need, but they find that grouping. Now, how that ends up being used in city building, I can tell you don't work for a lot of private developers who are using that data to go out and reach a low-income population. No, they're only looking at the top percentage.
So this is a new frontier.
Well, that is a new frontier. I don't know. No, there's always been more building for the rich than the poor. That is true. Okay. What's different now, I think, is the possibility that the automobile gives to separate them so much. It used to be that you had we looked at moving to DC not that long ago and started looking where we could afford a house. And there were these lines that we found out. We could afford a house here, but 2 blocks away, there's no way we can afford a house. New Orleans was like that too. That's not true in Atlanta. If you're low income and you're working at a retail level job, you probably live in the south of Atlanta and probably 15, 18 miles away is your retail job in the north of Atlanta. So the ability to separate is much greater in planning now.
Is that good or bad?
Oh, I think it's terrible. I think
So it's better to have more integration, and we have the capability to understand the ability to do that?
yeah, I mean, sure, there's a, Brookings Institution does a lot of, it's called the jobs housing balance.
Mm-hmm.
You know, are your houses near the jobs, you know, and are the houses at the price point for the people that work at those jobs? And they look closely at that.
Awesome.
Well,
And you're nodding your head.
Yeah,
yes.
just one final comment. This is going to be a really big problem for the boomer population to bring it to the aging world. I've been interviewed quite a bit lately. There's this narrative in the press about the boomers moving to the suburbs. I mean, boomers moving from the suburbs into the cities in droves. And I say to every reporter, you know, how many of them have looked at the prices of what they're going to get in the city in terms of housing? And, you know, who can really, a certain subset can afford that, sure, but not everybody can afford it, if they even want to move. So I'm just really concerned that there's not going to be, there's this sort of thought that people are going to be able to move easily and it'll be no problem. And I just think a lot of people are going to have sticker shock, and that's something we need to be thinking about, because they're not going to have the option to move if they want.
Awesome. It is now Q&A time. So Patrick has the roving microphone.
Yeah, anybody who has a question, please raise their hand. I'll bring the mic to them. And please speak into the mic, because we want to hear your question. We're also recording this program.
Well, when you're talking about, you know, adults and boomers and all these aging populations, and yet we have created hundreds of sun cities, regardless of what state they're in, all across the country, where they're all dendritic cul-de-sac things with a fancy clubhouse with a pool, and that's about it. And I just wonder if anybody is looking at or encouraging more development that meets the complete streets model and has, you know, something like you might see out in Columbia with, you know, the little areas with the cleaners and the store and the things like that, you know, because none of the Sun City things are done that way. And is there anything out there that's coming up that's more reasonable?
Are you asking, like, are there good cases out there where people are doing this the right way or the better way?
Yeah.
Okay. What do you know?
Well, I'd say first the right way would just be to integrate that housing into a good environment rather than create the specialized. Are they doing? I work on this a lot, and I can tell you right now, in dealing with folks like Del Webb and Sunrise and these major developers, they're getting in the pools, the REITs that fund their developments are making a 25% return. That makes innovation nearly impossible, right? They cannot knock that stuff out quick enough. And they've got folks lining up in this economy to take a 25% return. So there's unlimited funding, and it is so simple. Who would change that model? You know, why would you ever mess with something that's giving you a 25% yield? So the profitability of the very thing that, you know, that I think I find disturbing, that's a highly profitable enterprise right now. So until that is less so, I don't know.
Is anyone bucking the trend?
What's that?
Is anyone bucking the trend? Any example in the United States that's doing it well?
Oh, I watch this pretty closely. I don't think a lot of folks know they need to. What the dialogue now is about disruption. The question is, does the people who, the 3% of the population who moves into senior housing, right? 3% of the eligible population of the market actually takes advantage of that product. Would that 3% go to a different area if a different product was available? Or is it simply the product is being delivered in one form and it's the only thing out there? So I think the nagging thing that's on all the CEOs' minds right now with Del Webb is if we did get something integrated out, if we did get an alternative out there, how would it fare, you know? If that did well, not only would that receive more investment, but it's very likely that this other investment would crumble, right? If this turns out to be the only choice, and that's why people are taking advantage of it, not because they want to.
Well, it's only 3% of the population is going into that model, and they're all staying where they have a more integrated model. Wouldn't it make sense that that's an untapped market for something different and more urban?
I know, it's such a naive comment. Oh, I've become so jaded. But yeah, yes, it's a huge untapped market. The problem is the tapped market is so lucrative. Right. You know, you can't. If they stopped making money doing what they're doing, then we could get them to do something else. Yeah. But as long as that's generating a 25% return, it's going to keep pumping it out.
Doesn't that happen in so many parts of society?
I guess.
Right, that issue. Okay.
Robert knows this extremely.
I want to, any other questions? But I also want our physician, we've been picking on you all night, so can you just tell us who you are and why you're here and any comment? Just real quick. We want you to have a name with a face. Name with a face.
You want to know my name? I'm Dan.
Hello, Dan.
Foster,
Welcome.
And I'm a neurologist. And I recently saw a patient who was a pedestrian struck by a car, and I asked him. I was trying to deal with his symptoms, but I'm that 10%, you know, on your slide, which is the determinants of healthcare, of the determinants of health are the 10%, and so I was wondering, like, you know, why did you get hit by the car? Asking him a little bit more, and there's a school that he works at, a middle school, that's on one side of this road. There's a 7-Eleven on the other side of the road, and there's a park, and there are all these houses, and guess what happened? You know, people cross this street. There's no crosswalk. The traffic is at least 30 miles an hour, and there's a hill, limited visibility, and he was hit, you know, and that was completely preventable. And it's a design flaw, you know, and looking at, reading a little bit about it online, there's all this back and forth about how it's the pedestrian's fault and nobody should be walking across there. I wouldn't let anybody walk across there, and he's stupid for doing it. But it's going to keep happening. It's just a complete design flaw. What do you expect? You put all these, you know, you put a school here and you put services on the other side.
You put a bus stop here.
How long ago, Dan, did this happen? Did you encounter this patient?
This was a year and a half ago.
Year and a half ago. All right. So what do you have to say to Dan and the other neurologists and physicians that come here after seeing this story, experiencing this?
I am shocked it doesn't happen more. Honestly, with the way our streets are designed, it's unfortunate, and I mean, I think that's why we're all sitting up here, because we want that to happen less. You know, I was participating in one of the audits that I mentioned in New Jersey. We were auditing the Black Horse Pike near Atlantic City. This was before Sandy. I have never been scared in an audit before. You know, usually I had a yellow vest on. We usually travel in big packs, and it's fine. This scared the pants off of me. And we were crossing in sort of crosswalks. And I just think that there are so many roads like that across the country that if people got out and walked a little bit more and got scared, it just shocks me that the 3,000-pound car and driver aren't blamed instead of the pedestrian. So I just think that more needs to happen. More people need to be out walking so that these roads will change.
The transportation planning, I mean, I keep stressing blended metrics. I mean, that, if you ever dealt with transportation, I mean, not Jana, but other transportation plans.
Jana, by the way, get ready.
Other ones.
Patrick.
Other ones. This is the single-mindedness of it is astounding. You know, it's mind-boggling. The inability to entertain multiple data points. I mean, and the examples of that are everywhere. If you look in any state route, that's got federal funding in it. If it's through an urban area, it has a sidewalk on the side. And in transportation planning, the automobile has to have an 8-foot recovery zone so that if you're drunk or you're texting and you lose control of your automobile, you have 8 feet to recover control of it before you hit something hard that might damage the car, right? And like in Atlanta, Peachtree Street, the sidewalk is the auto recovery zone. You can't plant trees. You can't put light poles up that won't bend over. You know, you can't put anything there that might hurt a car. You know, and pedestrians don't hurt cars. They really don't. I mean, little dent, small fix. But this kind of thinking, you know, I mean, it's the same thinking that goes into, you know, you design as a transportation planner around, there are design speeds and there's target speeds, right? And the target speed is designing a street so the cars move the speed that you want them to move. That's not how transportation planners work. They say, okay, this street is a 35-mile-per-hour street. Therefore, in order for me to safely maneuver a car 35 feet, I need 10 feet of travel lane. But to be extra safe, I'm going to add another 2 feet and have 12 feet of travel lane. And everyone knows, I mean, it's so thoroughly demonstrated that when you add that extra 2 feet, the drivers feel more comfortable and accelerate to 70 miles per hour. So every foot you add adds another 10 foot of space. So, but the transportation planner is thinking, safer for the car, don't want to scratch it if someone's opening the door on the side. When you widen that street, it speeds the car.
So let me ask you, so you've got 2 physicians in this audience, or up here and one there. Is that unusual? I mean, is that a new thing to have doctors having this conversation? Irene, you work with doctors. Is this a new phenomena, and what can we do to help you, or can we help you?
Oh, I actually think you can, because I'm a PhD epidemiologist. MD's voices, when you whisper, are louder than mine.
What?
Yeah. Absolutely, absolutely, absolutely. Are you kidding? I'm really serious about it. So if, as physicians, so AMA, for example, I think actually the pediatrics, National Pediatrics Organization is supporting safe streets. I believe they signed on. I don't know about AMA. But if you're all members of a national physician organization or whatever organization you work for, if you can alert the people who speak for your organization, that you will have you have influence.
So Scott, Amy, Irene, so the Dans of the world can connect with you and can help be a voice. So I mean, can you imagine a physician being in this room when you're trying to have this conversation about safety, and would that be useful?
If what your focus is people and their behavior and the environment, inevitably we're going to be talking with you and you. I mean, inevitably, if you're talking about people moving in the environment, planners don't talk about that. They talk about throughput, vehicle speeds. They talk about density, water volume, sewer volume, water volume. These are the things we talk about. The last thing you talk about is people.
You said that earlier today, say planners are just getting to talk about people.
Yeah, and it disables us from talking from others.
And yet the first thing Dan talked about was person. It's a good match, right?
Well, I wouldn't say the medical profession is entirely person-centric.
That's a different panel, I think.
We have shining examples that are always...
I'm here ragging on my profession, and he's like polishing his breath.
Always find the coalition.
Well, and I think the frustrating thing, though, is that there are solutions that will keep cars moving, but they're not being put in place. So that will keep cars moving, but are safer for pedestrians. The cars might move a little bit slower, but they will everybody will stay safer. I mean, there is the ability to, so there is a solution. I think that's what frustrates me the most, is there actually are solutions to this problem. They're just not being implemented enough, and we need more people saying, look, people are going to cross the street, drivers are going to drive in places, according to their environment. We need to follow the people versus
and we would say we would want to raise overall total health, not to use our term, but what's the total health of what we're doing, right, for everyone, which is a combination of the person trying to get to a park versus cars. Jana.
Sorry you've been put on the spot, Jana.
Tell us who you are.
Okay, Jana Line at AARP's Public Policy Institute and author of Planning Complete Streets for an Aging America. And Scott, you've referenced my name so many times, I feel like I have to say something really profound this evening. I'm not sure that's going to happen.
It's all informal. We're among friends here. Don't worry about the lights.
But I guess, Scott, first of all, I think your account of how Complete Streets was coined is very close to being accurate. Probably Barbara McCann shares some of the credit for coining that term, along with David Goldberg. But beyond that, yes, we've all benefited from having a better way of talking about streets other than safe accommodations for bicyclists and pedestrians, blah, 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 blah. So that's a very positive step. We are now entering an era, at least at the federal level, that complete streets may be looking like a dirty word among some, and trying to figure out other messaging around that. Safe streets, but again, that doesn't address the full range of what complete streets is all about and the potential there. So we're kind of grappling with that right now. I wanted to say that I got chills as our neurologist was talking about his patient. I believe I know this incident on a somewhat personal level. I'm pretty sure this is my son's middle school, and I forbid my son from crossing that street to the 7-Eleven, but I have no doubt that in adolescence he will probably not follow that advice at some point in his career. I also know that the jurisdiction in question is planning to build a third school on this big, massive block, and it's a block that's landlocked. There's no through streets. It doesn't have the connectivity that Irene and Scott talked about, so it's just channeling all this traffic makes it very, very difficult to figure out what a design solution would look like. But we do need a design solution, so just thought I'd mention that. I guess, Irene, I have a question for you, because I know some of your research, and you've really looked at how older pedestrians relate to their walking environment in somewhat different ways than younger pedestrians. Can you just talk a little bit about that and what kinds of things we really should be considering for the oldest among those?
Sure. So, yeah, actually Jana's talking about something that's in process, but she has also insider information about it. I have to do a little bit more work on it before it'll be available for all. But I became aware of a method that's not used very commonly in medical public health, but it's a way of synthesizing research using a realist synthesis approach that was developed in England, where you take the research that's been done, and it doesn't have to be formal, peer-reviewed, it could be reports that have come out, and look at how in the reporting of the information, the mechanisms by which something is done causes a certain set of outcomes. So I used this approach to summarize about 115 articles that were all about older people and looking at walking and exercise and looking at built environment characteristics. And what I found is, so all of the research was older people. I didn't look at the younger people, so I can't necessarily contrast. It's entirely possible that the younger people factors would be very similar along the lines of some things that have come up here tonight. That is a caveat. What I see in the articles that are just about the older people is that safety is really, really key. So perceived safety could be around crime and violence safety, which is certainly something that, say, somebody like me in Oakland, that will be a topic that gets raised regularly. But also then the safety of the sidewalk, whether it's there or not, or if it's maintained, you know, the cracks in the sidewalk situation, or icy circumstances. And then aesthetics. So I mentioned that in my presentation, that if there's something to look at, if it's pleasant, if the environment is welcoming, and then amenities and resources. So if you have a destination to go to, whether it's to go visit a friend, to go run an errand, to make a purchase, and that I think is related to, in part to connectivity, because if you're talking about that cul-de-sac design where there's just the fancy clubhouse and not much else, that would not fit that scenario that I'm finding in the papers that I looked at.
I think that was the final word. We will be up here. Irene is going off to the West Coast. Everyone's jet setting tonight. So thanks, Amy, Irene.
Thank you very much.
Scott.
Thank you, Ted.
And we're here. Yes, thanks, me. We'll do our best. We're trying to do better.